Hello, everyone. This is Rebecca Green for the Whiny Palooza podcast, and I am so excited today because we get to talk to the wonderful Mallory Callens. Mallory, thank you so much for doing this with me today.
Yes, of course. I'm so glad to be here. Thank you for giving me the space and just creating the space for parents and everybody to listen in and just have this space to connect.
Thank you so much. I'm extra excited to talk to her because you're going to find out why. This is really, really important what we're going to talk about today. She has her MS, her APC, and her NCC. I might have to ask her what all those initials mean.
Yes, absolutely. I'm happy to go over all of them.
She is a certified mental health therapist with Key Counseling in Atlanta. She specializes in eating disorders, disordered eating, body image, anxiety, depression, life transitions. Let's make sure I get this right. LGBTQIA plus. Did I do that
Yes,
right?
you got it.
And teen support. She takes a warm, non judgmental approach and often works with both teens and parents to help families better understand eating disorder recovery, self harm concerns, communication, body image, food, and emotional safety. And as I told you, this is just heartbreaking to me how prevalent this is. I just want to start. Well, let's start with your initials. Tell us what all those
Yes.
initials mean.
Yes. So my MS is my master's in science. I have a master's in clinical mental health counseling, which I got from Mercer University, which is here in Atlanta, Georgia. And then my LPC or my APC has actually transferred to now it's an LPC. So I'm fully
Mm,
licensed. I'm a licensed professional counselor.
okay.
So a little bit of an update there that happened recently. And then my NCC, I'm a nationally certified counselor. So it's a lot of letters and initials, all basically just saying that I am master's level in being a mental health therapist.
It's all just saying how fabulous you are and how much you're going to help us today.
Thank you. Thank you.
Oh,
Yes.
I love that you work with teens. We need you. And I just want you to tell us like what are you seeing most often right now with the teens in your office?
Yeah. So, because I specialize in eating disorders, I do see that so frequently. I have so many teens that just struggle so much, whether it's a diagnosable eating disorder or just different disordered eating behaviors. I see it so frequently, and it's always connected with body image struggles. I so frequently see teens come in that are comparing themselves to what they're seeing online, whether that's social media or the YouTube videos they're watching, or even the TV shows that teens are watching nowadays, and music videos and things like that. I'm seeing a lot of comparison to that. I feel like we are going into a new wave of diet culture and just where things are at with body positivity and things
Mm.
like that. And it's absolutely affecting teens. So I'm seeing that happen a lot of just comparison. Even just comparison to their peers, to family members, things like that. So that's what I'm dealing with a lot. Absolutely.
So sad. And you said something that I want to back up to because I think our
Mhm.
listeners don't know. So you said eating disorders and disordered eating. And can you tell
Yes.
everyone the difference?
Yeah, absolutely. So in diagnosable eating disorder, we've got quite a few different ones these days, but common ones are anorexia, bulimia, binge eating disorder. Those have a criteria to get diagnosed that therapist or anybody who works with mental health has to follow that criteria. And while it's really helpful to have that criteria to be able to diagnose and treat and all of that, it also leaves a lot of people out. We've got a lot of people, whether it's teens, adults, whatever, a lot of clients who engage in these behaviors, but the frequency at which they engage in the behaviors, their BMI, body size, things like that might not fit the criteria required for a diagnosis, but that doesn't exclude them from the risk, the harm, the struggle that they experience and face by engaging in these behaviors. So I always make sure to include, when I'm talking about eating disorders, to also include disordered eating. Because, like I said, those people are struggling just as much as somebody with a diagnosable eating disorder.
Mhm.
They just, for whatever reason, are getting left out of that diagnostic criteria. So, if you have a teen or you yourself is engaging in restriction, or purging or any other type of behavior, it's absolutely able to cause harm and long-term effects, and you're struggling just as much.
That's a really good explanation. I mean, I think that people listening are probably thinking, like, what are the signs? Like, what should I be looking for? Because they might not even know.
Yeah, absolutely. The most common behaviors that I see in teens, I'm not saying it's the most common for sure, but just that I end up seeing in teenagers is restricting or purging. So restricting is going to be just almost like extreme dieting. It could be that they're following a really strict diet, whether that's keto or Whole 30 or all these different diets that are out there nowadays. Or maybe they're just skipping lunch or skipping breakfast, or eating half of what they used to eat at lunch and breakfast and dinner and things. So that's definitely a big red flag to look out for with your teen is just decreasing the frequency in which they're eating or being a lot more strict about trying to follow a specific diet or even just trying to eat like really clean or really healthy. If that's a new thing for your teenager, it's definitely something to be paying attention to. It could definitely be a red flag. And then with purging, it's going to be things like forcing themselves to throw up. Extreme exercise after eating can be a behavior as well, with purging that I see. Laxative abuse, that type of stuff. But again, the two biggest ones I see is the restricting, and then like forcing themselves to throw up. Purging are the two behaviors that I see most frequently. And with purging, I think something to keep an eye on is making sure that you know what they're doing after a meal. You don't have to like hover and be a helicopter parent, but if you notice your teen is always going to the bathroom after a meal, or always going to work out right after a meal, or getting in the shower right after a meal, things like that, that's definitely a red flag to just pay a little bit more attention or ask what's going on. That does typically seem to be the times that teens will retreat to being by themselves or engaging in a behavior.
I mean, so I'm just thinking what parents would want to ask you. I think a lot of
Yeah.
people would say, I'm not really sure that this is a big deal.
Hmm.
So how do they know if this is a big deal or this is just really not that concerning?
I always say it is 100% better to treat it like it's a big deal when it first starts than to wait for it to actually become a big deal. So if you've got a teenager who maybe is doing any of the things that I just talked about, even in a way that maybe doesn't feel so concerning, it's not unhealthy for somebody to decide they want to eat a little bit cleaner or healthier or something like that, or engage in more exercise. But just be asking questions, check in, figure out what's their intention for this. Are they just wanting to be healthier, but they're able to find some balance while they're doing these things? Or are they trying to lose weight, or do they just not like how they look? If it's something with an intention more along those lines, that's definitely something to maybe start thinking about finding help for. I always say to parents, you don't have to bring your teen in when they're like level 100 of this. You can
I
bring it
love
in,
that
bring them in
advice.
when it's level 1. Therapists are
Yes.
more than happy to help with a teen who's maybe just in the very beginning stages or just having some like initial thoughts. And also, therapists are happy to help teens find balance for that stuff too. My goal is never to make teens like stop eating healthy or stop exercising and moving, but how can we find a balance that's healthy where you can still have the sweet treat, with your friends when they all go out for ice cream, or you can skip a couple days of exercise because you're sick or you're on vacation or something like that, and not let it bring an intense amount of anxiety or depression or anything like that.
Really, really good advice. I
Yeah.
love that you clarify that. They don't have to be at 100 for us to get them
Mhm.
help.
Yeah,
That's
absolutely.
great. Great advice. So, as parents, we say a lot right and we say a lot wrong.
Yeah. Hmm.
You help us with that? Like what should we not be saying?
Yes, I get that question so frequently. And we're always going to make mistakes as parents, as humans, it happens.
Yeah.
So one, like let the expectation down that you have to be perfect and always say everything right because you're not going to, and that's okay. That's normal. It's how life works. But I do think any kind of body comments or food comments, anything related to any of this, just really thinking about it. I always tell parents that teens especially, they are watching their parents way closer than we realize. Um,
Unfortunately.
yeah. And so when you're making a comment about your own body or a celebrity's body or anything like that, they're hearing those comments and they are internalizing them. I hear a lot people commenting about celebrities and things like that. And, it feels so harmless to just be like, oh my goodness, she's lost so much weight. Like she looks so much better. And, that's not even a mean comment, but a teen hears that and is like, okay, I'm a 15-year-old girl. I've gained 20 pounds in the last couple of years because, of course, a 15-year-old girl has. But that 15-year-old girl is seeing that as, and I look worse because of it.
Mm.
So it's just really important to really think about how all of these comments can affect a teenager whose brain isn't fully developed yet. And of course, they're going to internalize these things at a different level than an adult's going to. So I always just encourage parents, like, try to just not make comments about people's bodies, especially in front of your teen.
I love that.
But it's actually just really good for ourselves to practice that too. Whether it's a comment about your own body or somebody else's body, it's really beneficial for us to just not even make those comments or even try to go down those paths. Another big thing I really recommend is to try not to put moral value on food specifically. Something I hear a lot is like, oh, like that type of food, that eating cake is bad. Cake is bad for you. And of course, it's not healthy to eat cake after every single meal, every single day. But there is absolutely great and wonderful value of cake too. Cake is a great food to celebrate with. Typically, if you're eating cake, it's maybe somebody's birthday. And that's great. It's wonderful to get to celebrate somebody with delicious food. So there's good value and bad value for all foods, all down the spectrum and down the line. So it's just important to try not to put any moral value on food either. You can teach your kids and your teens healthy boundaries and healthy relationships with food and trying to find that balance despite what the food is.
Totally agree. I mean, we want them to be confident and we want them to have a
Yeah.
positive self body image. So, what
Mhm.
can we do as parents to help encourage that?
Yeah, so I think kind of going back to what I said of trying to focus on your own relationship with your own body can be so important because teens are watching you. So taking care of your own body in a way that is balanced and healthy, which means eating all different types of food and enjoying all different types of food. You can really talk about maybe why you're making decisions about certain foods. So you can recognize of like, yeah, I'm eating this meal because this is a whole, complete, nutritious meal that's going to allow me to feel really good. It's going to energize me. I've got a long day ahead of me, so I need to make sure my breakfast is full of nutrients and has a lot of great, healthy carbs for me. And then on the flip side of like, yeah, and I can't wait to have cake tonight when we're celebrating your birthday because it's delicious and fun. So you can really model that behavior of talking about different foods and yeah, how they can be balanced and healthy. And you can do the same thing about your body of like, if you are a parent who chooses to exercise, that's great. That's health, that's modeling healthy behaviors with exercise and talking about, I like this exercise and it makes me feel really good. I feel really energized every time I go and I exercise in this way, or I feel really strong and I love how strong I feel, helps me feel confident. Instead of like focusing on like I'm exercising to lose weight or to tone up my arms,
Right,
those
right.
might be goals that we have, but trying to model to your teen that you're actually exercising or eating in a certain way to feel good and feel energized. Because realistically, that's what all these things do for us as well, is they really help us feel better.
I love that you're focusing on us because that gives us some power of what we can do differently. And I
Yeah.
love that you're talking about how, like, they're always watching us. Parents
Hmm.
do not realize that they watch
For sure.
everything we do. So thank
Yes.
you for saying that. That
Yeah,
is so
absolutely.
true.
Especially once they hit those teen years, I feel like sometimes parents start to think like, "Oh, well, they don't even like me. Everything I say, they fight with me on, but they're still watching."
Watching all of it. Well, and
Hmm.
unfortunately, it's so sad to me to even say this, but a lot of times we're seeing eating disorders and self-harm.
Absolutely.
So, can you talk about that and why that's happening?
Yeah. I always say eating disorders are a form of self-harm. It
Mm,
is just a different flavor of it, you know. So we do always or often see that overlap. Whether it's a teen who maybe engages in self-harm and engages in eating disorder behaviors, or vice versa, or they maybe switch. They started with self-harm and then moved over to an eating disorder. Um, it's a coping skill, a maladaptive coping skill, but both of them are coping skills to handle something bigger going on, whether it's anxiety, depression, OCD, trauma, body image concerns for whatever might be happening, it is releasing a bigger emotion for them. And so I always am talking with teens and parents about how can we teach them different coping skills? Because at the end of the day, if we just tell them like we're going to take away everything that you use to engage in self-harm and we're going to make you eat X amount a day and we're not going to let you purge, we're going to supervise you 24/7, that might stop these behaviors, but it's not going to stop the pain that they're feeling. Then they're just not going to have a way to express and release that pain. So something I'm always trying to do is coming up with a safety plan of a self-harm safety plan or an eating disorder safety plan, whatever we need to call it, of what are some coping skills that they can develop instead that are going to be healthier, help them release those emotions, those feelings in a safe way that's healthy and that they can grow into as they continue to develop as well.
Absolutely. Well, and I want to
Mhm.
back up and I want to apologize to everybody because I'm realizing that people might not know what I'm talking about when I say self-harm.
Yes. So self-harm can include so many different things. I think the most common things that we think of when we talk about self-harm is cutting. A lot of teens, and adults, but mostly younger people, engage in cutting typically on their arms or their thighs are the two most common places. So I hear that a lot. I hear a lot of like burning, whether they're using a lighter or even an eraser sometimes can do it. So things like that. So I always talk to parents about just make sure you know like what's in their room in their bathroom, you know. Typically it's like scissors, razor blades,
Mhm.
lighters, even just like razors that we use to like shave our face or our legs, things like that. Um, just keeping an eye on where those things are at, you know. If you're noticing this teen is going through razors a lot faster, things like that, it's something to just kind of raise a red flag. Or if the scissors are always in your teen's room, you know, things like that.
Yeah. Thank you for explaining that. I just
Yeah.
realized everybody doesn't know what that means. So thank you.
Yeah. Yeah,
Yes.
absolutely. It's a triggering thing to talk about, but it is happening. And it is important for parents to know like what it is. You know, I always talk to parents about this too, of just the impact of social media. And there's a lot of different forums on social media that are actually teaching teens what self-harm is. And it's people who are very sick and need help as well. But teens are learning a lot on social media. You know, sometimes what they learn is great and helpful and wonderful, and sometimes what they learn is really dangerous.
That's terrible. That
Yeah.
is really, really sad. And we want our kids to talk to us. We want to keep communication open with our teens.
Mhm.
How can we do that?
Yeah. I know this stuff is hard to talk about and it feels maybe awkward or like you would be introducing them to this if you were to bring it up, but chances are you're not. If they go to public school, or are on social media, or even if they go to private school, but they're surrounded by other kids, um, they probably know about these things, maybe not in explicit detail, but they know what self-harm is, they know what eating disorders are. So I think just keeping the conversation open, you can talk about like, your own struggles maybe that you've had in the past of like it was hard for me to go through puberty and for my body to change, like just want to make sure that like we talk about that for you, and if you're struggling with that, um you can just talk about it in really healthy ways of like I said before, just making sure you're verbalizing why this exercise feels good for you and why you're making balanced food decisions. That's definitely a good way. But again, I always think just trying to keep the communication open is the most important thing. And teens are going to feel a lot more awkward bringing things up that they're going through than a parent is going to feel just bringing it up in general. And so sometimes parents, we just have to make the harder jump and just start the conversation, even if it feels awkward and uncomfortable. Of like, I know that this goes on with kids your age, like just opening the conversation, like even if they are like, yeah, like my friend doesn't eat lunch ever at school. And I noticed that, that's a form of conversating as well about it. So I think that's really helpful and can definitely be a good space for it too.
Thank you. I would agree. We got
Yeah.
to bring it up. The hard
Mhm.
topics.
Absolutely. I
I
know
mean, I
it
know,
sucks and it's not fun, but again, it's
no.
way harder for them to bring it up. So there's never
Yes.
been any communication started. It's going to feel nearly impossible for a teenager to bring that up with their parents.
Yes. Thank you for explaining that to us. And I know you talk to so many teens, so I would love to know what you think teens wish parents understood.
Yeah. And this is something I talk to parents about too, especially once it comes up. Um, I wish or I wish the let me start over. I know teens wish that their parents could better understand that social media is going to be here forever. And
Mhm.
the answer is not that teens can just not be on social media. I hear so many teenagers come in, and these are 15, 16, 17-year-olds who have never, ever had social media. Um,
Wow.
and I totally get it from a parent's perspective. Social media is a terrifying place.
It is.
There's a lot of scary things happening there. But I always say to parents, they're going to be 18 one day, and when they go off to college, like you don't have that control anymore. And if they've never learned how to have a healthy relationship with it, like what are we going to do then? So I think that's the one thing that I would just love to talk to parents more about is how can we start social media in a safe and very controlled way that feels safe for everybody, both the teen and the parents, where they can be learning how to have a better relationship with social media and how to have better habits and all of that with social media. We could apply that to so many other things too, of just, it feels like it's the safest thing to shelter our kids from everything we can right now, but that's almost never the best answer in parenthood, even though it feels the safest in the moment. So I think that's definitely the biggest thing I hear from teens that parents just need to know and need to be thinking about, especially if you've got younger kids, like starting to figure out like what's that going to look like when they start to hit that like middle school, high school age.
Hmm. Yeah, I agree with you completely. And I think that they want us to understand that better. And I think
Hmm.
that we also have lots of misunderstandings about eating disorders.
For sure.
Anything
Yeah.
that you'd like to clear up?
Yeah. Yeah, I mean, there's so
There's so
many
many.
things.
There's so
Yeah.
many.
Yeah, and there's so many like specific, like nuanced things too. Um, I think for a lot of parents, I think just understanding that eating disorders are a lot deeper than just eat or just like get over it or stop doing that. Kind of like I said when we were talking about self-harm, it is a coping skill for something else. What even if it is just like major body image concerns when somebody with an eating disorder is eating or doing what feels really triggering or scary for them, their nervous system just goes haywire. It is out of
Mm,
control. It feels like somebody is trying to attack them or they're in a harmful situation. Um, and a lot of parents, I don't think, fully understand that. I think that a lot of parents sometimes can think it's just like just eat or just get over it, like you're fine. But I don't think they fully understand what's happening at a nervous system level of how dysregulated people with eating disorders can get. And so I think trying to bring a level of sensitivity, if you're noticing that your teen is struggling with these things, is really important. They're not in trouble if they are skipping meals or you find out they're purging. I hear this a lot too, that a parent doesn't know how else to respond. And so they'll yell at their teen, you're grounded, you have to eat, you can't get up from the table until you finish this meal. Um, but you've got to remember your teen's not in trouble because they're having a mental health concern. And so trying to bring a level of sensitivity into it, I think, is a really important thing for parents to remember. And if you're starting to notice these things and you don't know a lot about eating disorders, like I said in the beginning as well, get help in the beginning. Don't wait for this to be worse. Even if that help is just for the parent getting some psychoeducation of learning about things, learning about eating disorders, whether that's through books or podcasts or even a therapist. I know a lot of therapists, myself included, who would be more than happy to just do 2 or 3 psychoeducation sessions with parents of like, here is as much psychoeducation I can give you about eating disorders without even meeting your kid. This is just basic level psychoeducation, different eating disorders, what to look out for, things like that, that can really help parents have a little bit more knowledge and sensitivity of what's actually happening.
for sure. Absolutely. I mean, I think that parents would probably say that they become the food police
Hmm.
and they're making sure their kids are eating 3 meals and are they getting
Right.
any snacks and are they drinking water? I'm
Hmm.
sure that being the food police is probably not the answer.
Right.
So
Yeah.
what is a better answer than doing that?
Yes, you are right. The food police like is not always the answer. There might be a place of in the very initial stages of eating disorder work where that might be a little bit necessary. But then there does come a point where we do have to kind of let the teens spread their wings and figure things out themselves a little bit. Which can be really hard. I always say to parents too, I know that they become the food police out of a place of concern and love and worry, you know. It feels like it's all that they have to protect and help their kid. So it comes from a very loving place. But allowing teens to make mistakes is really important. That's where growth gets to happen. So giving them a little bit more freedom to maybe pick their meal, pick the amount, pick how much they want to finish, or not, or maybe get seconds, whatever that might be. And letting them go through a day or so of doing that. And, then they've got stuff to either talk to their therapist, their dietitian, their doctor, whatever professional they might be seeing. They have some content to bring to that next session of like, here's how the day went, here's how things were going. So I think that is a really important thing to think about. Instead of food police, parents can also kind of step in and just be checking in on like, on a scale of 1 to 10, how full are you after that meal? Of just bringing awareness. If a teen like has 3 bites at dinner and they haven't eaten anything since lunch, if a parent's like, well, where are you on a scale of 1 to 10? Like, let's actually like sit down and think about that. If a teen knows that they can have this open conversation and they can say like, yeah, maybe I'm only at a 4, and the parent's not going to be like, well, you got to eat more until you get to 10. I'm not letting you get off from the table. Of course, the teen's going to lie. They're not going to answer honestly if they feel like that's what the conversation will look like. But if they know that they can say, like, I'm only at a 4, but I don't want to finish because I'm anxious or I don't want to gain weight, and the parent can have an open conversation of like, that must be really hard for you. And what can I do to support you? And things like that. Does anything else sound good to you? Would you feel more comfortable eating anything else? Just trying to open options and have more open communication that's kind and empathetic and sensitive, I think can be really helpful.
Absolutely. Yes. Agree with everything you've been saying.
Yeah,
I think that I don't want to say it's the trend. I feel like that's such a bad word. I hear so much that these girls aren't eating lunch at school.
it's so
And I
common.
shouldn't say just girls because, boys have eating disorders too. So I'm not saying
Mhm.
just girls. But, I think if you're a parent and you're hearing about all these girls not eating lunch, what do you recommend to them?
Yeah, it's hard, right? Because if a 15-year-old's entire friend group is not eating lunch at school, it's so hard to be the only one eating lunch. So these things can be really complicated and they can take a lot of time to work through. So one, I think parents like be sensitive with yourselves too. This is not something you're going to fix overnight. So again, going back to that expectation that nobody's going to be perfect, things take time.
Right.
So go back to that first. But then coming back to the conversation of why lunch is important, why it's so important for especially a teenager who's at school all day and then maybe has a sports practice or a band practice or work or something like that after school, why it's so important for them to get those nutrients in the middle of the day. It's so important for their brain to be able to function properly. Your teenager probably has big, beautiful goals of going to college or whatever they want to do after school. They want to get good grades. They've got to eat to do that. Their brain's not going to be able to function if they're not eating properly and giving it the nutrients that it needs. They're not going to
Yeah.
be able to perform in their sport as well. They're not going to be able to perform as an employee or a volunteer or in band practice or again, whatever activity they're doing. So I think really trying to bring value to lunch for your teen in that sense and not just like a nobody else is eating and I want to lose weight. There's really not there's not a balance to that. You either are giving your body the nutrients that it needs or you're not. And your body needs those nutrients to get the good grades and play the sport really well or do whatever their hopes and dreams are. And I think being able to attach the motivation to eat to their hopes and dreams and motivations can be really helpful because it's not just like a you have to eat because that's just what you have to do. It's a I want to eat because I want to be really good at football. I want to be like a really good actor in my play after school, or I want to get straight A's. And recognizing the value that food has. We're not just eating because we have to eat, we're eating because it nourishes our body and it makes us stronger and more alert and all of those great things.
Well, and us adults know that. And I think you bring
Mhm.
up a great point because I don't think the teens always connect that.
Absolutely not. Yeah. And especially like it is hard to be a teenager. They're going through puberty, their hormones are shifting and changing all over the place. And like their bodies are just changing so much at that age. And so they might be tired and they might not feel like as alert as they once did or have as much energy as they once did, especially when they're having to wake up at like 5 in the morning for school. And then going until 7 p.m. if they're doing a
Mhm.
sport or activity or whatever. Teens, I mean, that's not easy on their bodies. And so that can sometimes be hard too when a teen is like, well, I'm tired anyways, like, you know? So just helping them by providing the education and the support that they need to realize that they're going to feel better if they're eating breakfast, lunch, dinner, and honestly, a snack and all of that too, and drinking enough water and all of that, even if they are still tired and moody and all of the things that come with puberty and being a teenager.
Yes, it's not easy. Being a teenager is not easy. We both
It's not.
remember.
I know, absolutely. It's so hard. I always tell parents, like, you've got to remember, I can't necessarily relate to the male experience of being 15, but I absolutely can relate to being a teenage girl. And that was so hard. Like
It was.
everything about going through
Yes.
puberty is awkward and uncomfortable and weird. Um,
Yes.
yeah. So just even
Agreed.
remembering parents that that's what your teen is going through and it isn't fun.
I tell my daughters all the time, I remember not being comfortable in my own skin as a teenager, so I know how they're feeling. We've all been
Hmm.
there, and hopefully
Hmm.
we can help them all through it.
Absolutely. Yeah.
Yes. But I will tell you that, recovery seems really challenging. Why is it so hard?
Yeah, recovery from an eating disorder is very difficult. And I say this to my clients all the time. Eating disorders are often looked at in the mental health field as really similar to addictions. A lot of the treatment lenses are very similar. The higher level of care facilities, like inpatient and stuff, they use a lot of very similar treatment models for eating disorders and addictions. But the really hard part about eating disorders is you can't just be sober from food. You know,
Right.
you've got to find the balance. And it would be like imagine telling somebody like an alcoholic to say like you've got to find balance with your drinking. That would be unheard of in the addiction space. So that's why recovery with eating disorders is so hard, is because the behavior that they're engaging in, they now like they still have to eat and be around food and look in the mirror and see what they look like, but they've got to find balance with it. And so it can be really, really hard, and it can take a lot of time to find that balance. I know people who are excited about going into eating disorder recovery and they're ready for it, they always come in and they are ready to start intuitively eating and having this perfect, like body positive or even body neutral relationship with their body. And I always warn them that might not be where we get to start with recovery. Finding balance might not look as intuitive as everybody wants it to look. But it is just really hard to find that balance and to figure out what that space is going to look like. And you're going to make mistakes, and that's okay. There are ups and downs in all types of recovery, but especially eating disorder recovery. Um, yeah, but it's just finding that balance. That is why eating disorder recovery is so hard. And we got to think about too, what is like happening culturally with body image and things like that. That's always changing. Somebody might have a body that is very much societally accepted for the moment. And then a month later, like something new comes in. We think about just different trends, whether it's with bodies or clothes or whatever, and how they've changed over time. Yeah, it's just that's always going to happen. And, our bodies probably don't change as frequently as the trends do. So,
That's true. And I didn't picture I was going to ask you that question. I didn't picture recovery as like linear, right? I
not at all.
pictured lots of ups and downs.
Absolutely. There's so many ups and downs. And you realize like you struggle with things that you maybe didn't even realize you struggled with before recovery, or new struggles will come up. Yeah, it's extremely up and down.
It sounds like parents need to be really patient through recovery.
Yes, 100%. I always say, like, if I have a parent who brings their kid in beginning of summer and they're like, yeah, just trying to fix this eating disorder before school starts back, I always warn them that's not going to happen. You
Oh
know, they
gosh.
might be in like a much better spot by the time school starts back, but the expectation that 2 to 3 months is going to totally fix an eating disorder is an expectation that is way too high. It's way too
That's
high of an expectation for the parent. It's putting a way too high expectation on the kid, and it's putting a way too high expectation on the therapist. So just being ready for the fact that this is going to be a journey, and that's okay.
mhm.
In 2 to 3 months, you might see a lot of improvement for sure. But new struggles will come up, especially with the fact that summer break, they're probably a lot less stressed and dysregulated, and then school comes back and the stress picks up and behaviors might come back a little bit. So just being prepared for if your teen is engaging in eating disorder behaviors and you are getting help for that, it might be a journey and that's okay. They might be in therapy for a few years even. Even if the behavior decreases within several months, the support of a therapist for a few years might be necessary and just be prepared for that.
That's a good explanation. I think a lot of people don't know that. And I also think that, you had touched on coping skills. And,
Mm.
I just want to talk about the fact that anxiety, depression, perfectionism, how does that all play into eating disorders?
Yeah. Eating disorders are a coping skill for all of those things. Like I said before, it's a very maladaptive coping skill. It's not helpful, but at the end of the day, it is a coping skill for them. If somebody, especially somebody who's perfectionist, I see a lot of my clients who struggle with restrictive behaviors or anorexia are typically very perfectionist. And it's because that level of restriction or intense dieting gives them something that feels like they're in control of. And of course, a perfectionist is going to love that control. So it does feel good for them to be able to control what they're eating in that way and control their body in that way. So yeah, I think just recognizing at the end of the day that it is a coping skill and you're just going to have to learn some healthier ones, for anxiety, if they have severe body image concerns, being able to control what their body is looking like is going to help their anxiety. They're going to feel less anxious about what they're looking like or what others are thinking about them, if they are controlling what they're eating or controlling what they look like, or at least feeling like they control those things.
Mhm.
Um, so yeah, I think just thinking about it in that sense can be really helpful that learning new coping skills is going to be a really important step of recovery.
Well, and I can guess that there's a lot of parents listening who feel scared,
Yeah.
overwhelmed, don't even
Mhm.
know where to begin. Can you give them some words of advice?
Yes. If you are listening to this and you are like, wait, I have noticed so many of these things with my teen, take a breath. It's
Mhm.
gonna be okay. If you are realizing these things, you're already helping them by even just realizing these things. I always advise if you feel like your teen has been engaging in eating disorder behaviors, 100% start looking for a therapist, but also go to their pediatrician. Make sure that they just get a basic like blood work panel done, check in, make sure everything is normal with their vitamins and their heart rate and things like that. Um, I wouldn't be checking weight all the time, but just keep an eye on their weight. Make sure, it's not typically normal for kids to lose weight. So just making sure that their weight is like staying at least consistent or increasing because that's typically what's normal for kids. Um, and then if the food piece is something that you're noticing a lot too, I always recommend if I've got a kid who's struggling with eating disorder behaviors, see a dietitian if that is in your financial ability and you can do the therapist, a dietitian, and pediatrician. Those are the first three steps. Again, take a breath, lower your expectations for yourself. You are already helping your kid by listening to this podcast and thinking about all of these things and taking whatever steps you can take. Um, but just lower those expectations that it is going to be a journey. There's going to be ups and downs. And yeah, you are already helping your kid by just even thinking about these things.
Well, you are full of so much good advice. I knew you would be.
Yeah.
And, I do want to ask you, do you feel like there's anything that I didn't ask you that you want to touch on before I let you go?
I feel like we touched on a lot of really good and important pieces. I hope parents can walk away from listening to this with just some knowledge or some things to be thinking about and reflecting on afterwards. I think other than that, just really continuing to touch on that social media piece is so important to me, just because social media is not going anywhere. It's one of my um, biggest passions right now is helping parents and teens find that balance. So I think parents, do your research about social media. I like if you're going to let your kid be on a social media platform, you should know all the ins and outs of that social media platform. You don't have to have a super active profile, but you should have a profile. You should be checking in on their profile regularly. So that's probably the only other thing I would just really advise with parents is start doing that research on social media soon. If your kid has a TikTok, you should also know the ins and outs of TikTok.
So you're telling me I better go learn Snapchat because that's the one I'm not on. I'm
Yeah.
trying to follow them. I told my older daughter, I'm like, are you watching your sister on Snapchat?
Exactly. Yep. Yeah. And Snapchat's a popular one these days. So, yeah,
Yeah,
parents, you should learn
I
Snapchat.
gotta look go learn Snapchat, everyone. So I do want to ask you, are you seeing people just in Atlanta? Do you
Mhm.
see people other places?
Yes. So for therapy, I can see people in Atlanta. I have an office in Atlanta and I do virtual sessions. And then virtually, I can also see clients from Florida and South Carolina. And within the next few weeks, fingers crossed that Georgia's about to pass. It's called the Counseling Compact Law, where I can see people virtually from almost every state. So
Oh,
that is very
wow.
soon to happen. If parents are listening to this and that psychoeducation sessions that I mentioned, if they're interested in that, we can do it as coaching until the counseling compact law goes through. So even if you're in another state and you'd be interested in just learning more about eating disorders, getting some parent coaching, things like that, coaching can be done over state lines. So I'd be happy to do some coaching. It's not therapy, it's not counseling, but I can offer that over state lines right now. If you're not in
Um,
Georgia, Florida, or South Carolina.
where can they find you?
Yes, you can find my information. So I'm Mallory Callens. You can find me on Psychology Today or on Key Counseling Group's website as well. They can find me there. And my
Well,
phone number is there. There's ways to reach out to the office on our website as well. So
thank you so much. You have been
yeah.
so helpful, and I'm so glad we got to connect.
Yes, of course. Thank you so much for having me.
This is Rebecca Green, and I want to remind everyone to spend every day laughing, learning, and loving. Thank you for tuning in to the Whiny Palooza podcast. If you like what you heard, please be sure to subscribe so you never miss an episode. While you are there, leave a review. I love to hear your feedback. Thank you so much for listening. Until next time.
This show has been produced by Market Domination LLC. To discover how you can have your own show completely done for you and turn it into a real published book and become the authority in your marketplace, go to www.marketdominationllc.com/podcast offer.